Hello, good morning. Yeah, welcome to my YouTube channel. My name is Temilade, or you can call me Temi. I am filming from the southern part of Nigeria. Top of the day to you in any part of the country you are watching me from. In today's video, I would like to talk about the minor disorders in pregnancy. And this minor disorders in pregnancy is just like the name implies. It is minor. It is not a major disorder that should raise an eyebrow. But if the symptoms persist beyond normal, you're advised to see your obstetric and gynecologist. And in these videos, I'm going to be talking about the disorders and also the solution or the advice or tips that the person can just use to overcome this minor disorder. And the first on my list is nausea and vomiting under the digestive system. And this nausea and vomiting is, they cause it morning sickness. And this morning sickness, as small as this morning sickness can be, this nausea and vomiting can be, it can deprive some women from carrying out their day-to-day activities, also caring for other children, and it can even go to the extent of depriving some women from not partaking in a full-time job. And this nausea and vomiting, it occurs at 4th week of pregnancy. This nausea and vomiting occurs, and this is due to the effect of human chorionic gonadotrophin, that's the HCG, during pregnancy. And this morning sickness is markedly increased between 5th to 10th week of pregnancy and begin increase at 20 weeks of gestation or at late pregnancy. It's prevalent in younger women, multi-gravid women, that is women that have carried pregnancy of maybe 4 to 5 children or more, multiple pregnancy that they all these twin gestations, triplets, quadruplets, and octuplets, anything that concerns multiple gestation. And also those that abuse alcohol during pregnancy, this can excessively aggravate nausea and vomiting in pregnancy for them. And also those that have an eating disorder like anorexia nervosa, bulimia, and etc. It does not have a significant effect on the birth weight. Maybe you now say, oh, because I was vomiting during pregnancy, that is why the baby weight is so low like this. No, it does not have a significant effect on the baby weight, on the gestational age, on maybe the baby was born as a premature. All these things, nausea and vomiting does not have a significant effect on them. And the solution for nausea and vomiting, the pregnant women are mostly advised to eat salad or carbohydrate snacks, especially at night, to prevent hypoglycemia. You don't want to enter hypoglycemia in pregnancy. Hypoglycemia just means when there is low level of glucose in the blood. I can just put it like that. That's hypoglycemia. Then moving on to the next one under digestive system is heartburn, and this affects up to 85% of pregnant women. And this heartburn is just a burning, just like the name implies, it's a burning sensation that is majorly felt at the mediastinal region of the chest. Just like this way some people say, ayan tummy in my tribe. So ayan tummy, this is as a result of the relaxation of the cardiac sphincter in the stomach, and it now bring about the reflux of the stomach content into the esophagus. This heartburn is more pronounced at 30 to 40th week of pregnancy, because the stomach is at that stage the stomach is under pressure from the growing uterus. An advice or solution to overcome or to conquer this heartburn is, firstly, the woman should avoid kneeling or bending too much, or frequent bending or kneeling while performing some house chores. Food should be eaten bit by bit just to avoid heartburn too. And also some food should be avoided, such as fatty food, fried food, all these things, they can aggravate the heartburn. And if this heartburn persists for a longer period of time, the pregnant woman is advised to see the obstetric and gynecologist or the midwife taking care of the pregnant woman, just to recommend some antacids such as Gaviscon, metoclopramide, and etc. And remember, do not use any drug out of prescription. Say no to self-medication during pregnancy, because you never can tell which part of the baby is developing at that time, just to prevent congenital anomaly. Then moving on, still under this digestive system, is excessive salivation. This is called, and in medical terms it is called tylism, from the hormones, from the enzyme tyline. So tylinism, that is excessive salivation. And this excessive salivation, the causes is unknown, but at the same time, progesterone and HCG in the bloodstream. This excessive salivation, and it's majorly it occurs at 8 weeks of gestation, of pregnancy. And according to research, a lot of women have complained that swallowing this thickened saliva can aggravate the vomiting center. It can make them to be nauseated and want to and make them to vomit. So they rather feel more comfortable spitting out the saliva than swallowing it. Solution for this, or advice for this, is the woman is just encouraged to eat gum or have ice, just little ice in their mouth. Although this is like a temporary strategy, it's not a permanent, or pending the time that the stage of excessive salivation will be over. Another thing under digestive system is pica, and this pica is craving for natural and unnatural substances. Unnatural substances such as coal, sand, charcoal, lead, etc. And don't allow it to shock you. That is why you have to give kudos to pregnant women. They are really going through a lot during that pregnancy stage. Some people, they will just be craving for things that are unnatural. It is not their fault. So you just have to give it to them, talk much to them. They are superhero. I commend them. And if the woman is now craving for unnatural things, like what I have mentioned earlier on, the woman is advised to see the obstetric and gynecologist for proper counseling, because if you are craving for things that are harmful to you and your fetus, you will never be allowed to take it, either you like it or not. And according to research, it has been reported that in Kenya, the pregnant women there, and according to research, it has been reported that pica craving in Kenya is as high as 74% and as low as 0.02% in Denmark. So constipation, another thing under digestive system is still constipation. This is caused by the relaxation of smooth muscle, and it is still under the effect of progesterone. And if you can remember, progesterone, HCG, estrogen, and the likes, they are just the pregnancy hormone. So progesterone will just be doing anyhow as it like during that stage. And this constipation affects about 40% of pregnant women. This constipation is triggered by dehydration, poor dietary intake, and the use of iron supplements. So advice now, or solution to solve this constipation, is that the pregnant woman is advised to increase fluid intake, at least 2 to 3 liters, to increase fluid intake, and also to take some fiber diet, and also increase fruit intake at that moment, so as to avoid constipation. And if all these measures are carried out and the constipation still persists, the woman should see the obstetric and gynecologist or the midwife that is taking care of her to place her on laxatives such as lactulose. Still remember, say no to self-medication. Do not say, oh, I know it, and you now go to over the counter to go and get some drugs, because some over-the-counter drug, they will tell you that they are the same thing, meanwhile they are not the same thing. So you still have to see your obstetric and gynecologist every time, especially during antenatal, to put you through on what to do and what not to do during pregnancy. And now moving on to musculoskeletal system, that is the skeletal system. They also call it skeletal system. And number one minor disorder under it is backache, especially low back pain, and this is due to the increase in the load and mechanism of the body, and abdominal muscle stretches and loses the ability to maintain posture, and as a result leave all the bulk of work for the lower back to carry, so that the lower back has to support the majority of the weight gain during pregnancy. So that's why the pain is mostly peculiar to lower back. And the advice or the solution to this is the woman should perform mild exercise to strengthen and to relax the back and the pelvic muscles, especially during the second trimester. The woman can just carry out some mild exercises. Then the pelvic girdle support belts and corsets are mostly useful in supporting the lower back during this period too. This pelvic girdle support belts and corset, they are mostly used in the developed countries. Also, the woman should maintain a comfortable position. The pregnant woman should maintain a comfortable position while standing, sitting, lying, or trying to carry out some day-to-day activities, just to prevent much pressure on the lower back and to prevent back pain. Another thing under musculoskeletal is cramp, most especially on the leg. And this pain in the leg is mostly worse at night. Most time the causes of cramp in pregnancy is unknown, but sometimes it is attributed to decrease in the level of vitamin B1 and also decrease in the level of calcium. And advice or solution to overcome this, not totally overcoming it, but at least to relieve it, is to relieve this cramp, is to the woman should have a warm bath, and during that process you just exercise the leg frequently. And also while sleeping at night, the foot of the bed can be elevated, or the woman can place pillows underneath the leg just to elevate the leg to 20 to 25 centimeters, just to improve and to relieve pain. The woman is advised to take the vitamin B complex during and calcium supplements, and that is why during antenatal, that normal routine drug, that yellow and red drug that they give you for routine checkup, is not for fashion. It's not to be kept under the pillow. It's not to be put inside your purse and want to come, and so that when your midwife asks you, are you using your drug, you bring it out, you say yes, I'm using it. Some people, they can even go to the length at which the length of removing some drug and be throwing it away, so that your midwife will not tell you that why you are not always buying drug, or why is this drug not reducing. Please, if you have this habit, you can desist from it. Thank you, and I hope you like this video, and please take out your time to listen to it, and some solution to can be used. And please don't forget to like, comment, subscribe, and share this video. Thank you. Bye.